Hello guys, I'm Deepak Shukla. Welcome to our channel Study Mania. I'm starting a series on psychiatry where I'll make videos on frequently asked questions in university exams. So let's start with schizophrenia. Schizophrenia is a chronic psychotic disorder characterized by disturbance in thought, perception, emotion, and behavior leading to impairment in social and occupational functioning with symptoms persisting for at least 6 months. So the duration is 6 months. Okay. Now coming to the classification of schizophrenia, according to ICD-10, we have paranoid schizophrenia, hebephrenic schizophrenia, catatonic, undifferentiated, residual, and simple schizophrenia. Okay, so classification we have to keep classified into 6 things. Okay, so you have to learn like this: paranoid, hebephrenic, catatonic, undifferentiated, residual, and simple. Coming to risk factors for etiology of schizophrenia, we have genetic predisposition, we have neurochemical abnormalities, means increased dopamine and increased glutamate. Okay, so these are neuroexcitatory, so these are increased, whereas there is GABA dysfunction. Okay, now we have neurodevelopmental factors that can also be risk factor, psychosocial stressors, okay, and substance abuse. So these are the risk factors for schizophrenia. Now coming to the very important point, what are the symptoms? So of schizophrenia, we have positive symptoms and negative symptoms. In positive symptoms, we have delusions, hallucinations, disorganized or bizarre behaviors like aggressive, agitated, odd clothing or appearance, odd social behaviors, and repetitive stereotyped behavior. Okay, so we have delusions, hallucination, disorganized or bizarre behaviors. Along with that, we have disorganized thought and speech. So these are the positive symptoms of schizophrenia. Coming to negative symptoms, that is very important. So they will have poverty of thinking and speech, that is known as alogia. Then affective flattening or blunting. Affective flattening or blunting is reduced emotions. Then alexithymia. This is alexithymia. Avolition. Avolition. Apathy. Anhedonia. What is anhedonia? Anhedonia means previously he was having pleasure in doing works, but in the same work now he has lost the interest. That is anhedonia. Then asociality and attention impairment. So these are the negative symptoms of schizophrenia. So till now we have seen what is schizophrenia, what are the classification of schizophrenia, what are the risk factors, and what are the positive and negative symptoms. And this is the way you have to write in exams. Now we'll see Eugene Bleuler classification of diagnosis of schizophrenia. Okay, so diagnosis of schizophrenia, there is classification by Eugene Bleuler. He coined the term schizophrenia. Okay, so it is very important, and he gave it as 4 A's. 4 A's. The first A is autism. The first A is autism, means social withdrawal. Then the second A is association loosening, means disorganized thinking process. Ambivalence means indecisiveness, he cannot take decisions. And affection blunting, that is decreased emotions. Okay, so if you remember these negative symptoms, it is very easy for you to learn this classification by Eugene Bleuler. So 4 A's you have to remember that this auditory hallucination is not in this. Okay, it is not in this 4A. Autism, association loosening, ambivalence, and affection blunting is in Eugene Bleuler classification of diagnosis of schizophrenia. Then there was person named Kurt Schneider. Kurt Schneider. He has described 11 first rank symptoms of schizophrenia. Okay, first rank symptoms of schizophrenia. So these are 3 thought phenomenon, 3 made phenomenon, 3 disorders of perception, means auditory hallucinations, and 2 special phenomena. Okay, 3 plus 3 plus 3 plus, okay, 11. So these 3 thought phenomena is thought insertion, thought withdrawal, and thought broadcasting. Simple. Then 3 made phenomenon is made impulse, made volition, and made affect. Made impulse means to commit an impulsive act. Made volition means to commit a planned or complex action. And made affect means to feel a certain way. Okay, so 3 made phenomena and 3 thought phenomena. Coming to 3 auditory hallucinations. In auditory hallucinations, there is first person, second person, and third person. The first person is through thought echo, also known as sonorization. Okay, this is first person by thought and echo. Second person is by command hallucination, also known as command hallucination. The voices talking directly to the patient and commanding them. Okay, the voices are talking directly to the patient. And third person is he hears multiple different voices talking around among themselves. Okay, so that is like running commentary. And two special phenomena we have: somatic perception or somatic passivity, or delusion of control. Here what happened, he believes that an external agency is able to cause body movements. Okay, so his body movements is because of some external agents, so it is his belief. And the second one is delusional perception. So these are 11 first rank symptoms of schizophrenia by Schneider: 3 thought phenomena, 3 made phenomena, 3 auditory hallucination, and 2 special phenomena. So now for diagnosis, following 5 findings are seen for more than 1 month according to ICD 11, and for more than 6 months according to DSM 5. Okay, so we'll take it to more than 6 months. Okay, for writing an exam. So what are these 5 findings? These are delusion, hallucination, disorganized speech, disorganized behavior, and negative symptoms that you remember. Negative symptoms mean this: alogia, affective flattening, alexithymia, avolition, apathy, anhedonia. So these are negative symptoms. So this is how you diagnose. Coming to management of schizophrenia. So this is how you have to write an exam. Okay, so first thing you have to write an exam is pharmacotherapy. In pharmacotherapy, first thing is antipsychotics. Antipsychotics we have typical and atypical. Okay, if you write in tabular form, you can use more space. Okay, so typical antipsychotics is haloperidol, flufenazine, or flupentixol. Okay, flupentixol. So the typical antipsychotics are haloperidol, flufenazine, and flupentixol. Then we have atypical antipsychotics that are risperidone, olanzapine, aripiprazole, and paliperidone. This paliperidone is given once in 3 to 6 months. Okay, so these are the drugs. Now, what is the duration of treatment? It is along 1 to 2 years and minimum of 6 months. Okay, minimum of 6 months is given, and due to non-compliance, long duration of treatment is required. And if more than 3 episodes persist, then lifelong treatment is required. In treatment resistant schizophrenia, means what is treatment resistant schizophrenia? Means it is not responding to at least 2 antipsychotics. We can go for clozapine. Okay, this is clozapine. So we are done with pharmacotherapy, that you have to write an exam like this only under this sequence. Now we have psychological intervention. Okay, patient oriented, we have to go for insight facilitation therapy or cognitive rehabilitation. So just use these fancy words in psychiatry and you'll get marks. Okay, so insight facilitation therapy, cognitive rehabilitation. And we can also go for social skill training that improves the relationship, and behavioral positive reinforcement of appropriate behaviors. Okay, so we can go for these things: social skill training, behavioral positive reinforcement, insight facilitation therapy, and cognitive rehabilitation. Caregiver oriented, so this caregiver has to decrease the negative expressed emotions such as criticality, hospitality, hostility. Okay, so they have to decrease this negative expression. Okay, if caregiver use this all these words, then there is more chances of relapse. The caregiver has to give some positive expressed emotions such as warmth. Okay, so these are all things about caregiver oriented. Now what are the indications for hospitalization? It is suicidal tendencies, then severe psychosis, violent behavior, and catatonic schizophrenia. For catatonic schizophrenia, we can go for ECT. ECT is electroconvulsive therapy. Okay, so these things are the treatment or management of schizophrenia. What about prognosis? We have to write rule of quarters: complete remission in 25%, good recovery in 25%, partial recovery is 25%, and downhill course in 25%. So this way we can write a 10 marker on schizophrenia. Keep in mind and that in management you have to write under subheadings like pharmacotherapy, then you have to go for psychological intervention, then you can use those fancy terms that insight facilitation therapy, ECT, cognitive rehabilitation, CBT, you can write anywhere, cognitive behavioral therapy. So write all these words in psychiatry and your answer is complete. So thank you so much.